Non-Americans of Reddit. What is your true experience with social health care in your country? German here. It's excellent. I broke my back a few years ago, don't worry, made a full recovery, and everything was covered. Including a helicopter rescue, months in hospitals and recovery clinics, new desk and chair for my office that are better for my back, a new mattress for my bed, etc. Total cost of the entire treatment was less than €100 that I had to pay myself. Mostly for using the hospital Wi-Fi. And that people have to wait ages for their appointments in such a system is also not true. I can usually get an appointment at my doctor's office in the next few hours if I calm them in the morning cause I feel sick. Sometimes people wait a little longer to see specialized doctors, but never when it's something urgent that cannot wait to get treated.
I've been T1 diabetic for nearly 50 years, and because I'm dependent on insulin, all my prescriptions are free. This is also true for some others who are medicine dependent.
I had several major hockey injuries as a kid, teen, and living in Canada it was no big deal. Received good treatment, costs were zero. My parents had to shell out for crutches, that's it. Conversely, we went south of the border once for a tournament and I was hit from behind into the boards, hurting my neck, back. Went to a hospital in Syracuse and had x-rays done, everything was fine. In terms of service, I'd say the hospitals were comparable. However, my parents kept getting bills for astronomical sums from the Syracuse hospital, even though they had purchased supplemental insurance from Blue Cross before making the trip. They received these bills, along with nasty creditor collections letters for years.
I'm from England and the NHS had been great personally. I get appointments quickly and it's even quicker if it's for a young child or there is possibility of cancer. The care I got whilst pregnant and giving birth was also amazing.
Canada. I suffered second-degree burns on 20% of my body. Daily bandage changes, 2 ambulance rides, multiple prescriptions covered through work benefits, and a 2-day hospital stay. I owe $45 for the ambulance, but my company has to cover that as it happened at work. Not a bad deal.
Ireland. Not bad, stuff's cheap, sometimes heading private is good but usually you don't need to. Ambulances are free I think, or very cheap.
The NHS has been great. They helped me with my broken rib, pneumonia. I spent 8 nights in hospital. Has X-rays, MRI and other scans. Lots of antibiotics and painkillers. I didn't have a bill at all. I sent the nursing staff chocolate as a thanks for everything. Even with my anxiety and depression they have helped me. I pay £9.20 for a prescription no matter what it is.
Based on a sample from 2 countries, universal healthcare is there when you need it. What's crazy about US is that a person in need will not ask for ambulance because they cannot afford it.
You say, true experience, like you think we're lying. Ah yes. I thought it was free but a month later I got a £40,000 bill through the door. The Brits never tell you the end of the story. After my cancer treatment was over, I had to work in the kitchens for 6 months to pay it off, but I consider that a fair exchange for my free treatment. Do you not think it's weird that you can't even imagine going to the doctor and not needing to take your wallet with you?
It's free, it works, it's being ruined.
I can go to the doctor for free whenever I want if I'm having a health issue. Pretty handy.
I live in Finland. My experience is that I don't have to worry about it. If I get sick or something, it'll be taken care of and I don't need to worry about the expenses. Also, I have affordable insurances for sports, so I can go to private doctors for a €100 fee and get x-rays, surgeries and whatnots.
Triage works. Urgent matters get attended to, non-urgent can wait a bit.
I've tried healthcare in Russia and Canada, both were reasonably good. Although, Russian healthcare outside major cities is a bummer.
I'm a GP, family doc, in England, and so if you're cynical I'm kind of the gatekeeper to patients seeing specialists. IMO the NHS does 2 things very well, routine, non-emergency stuff, and stuff that'll kill you quickly. My wife had mild anaphylaxis straight in, no questions asked, meds in 1 minute. Old lady cracks her hip, full replacement in 24 hours, no bill for the $1,000 prosthesis. Everything in between is kind of a beep. Skin and mental health in particular, anything more complex than your standard fare is gonna be a 3 to 6 month wait just for initial assessment by a specialist. One thing people don't talk about though is the existence of a viable public option puts a limit on private insurance's ability to charge. My wife has private insurance and her annual excess fee is £250. It'd be at least 10 or 20 times that if there's no NHS.
I'm originally from Spain, but now living in UK. I'll say both public healthcare systems are brilliant. The only time when you see some flaws in those systems is when a government starts defunding it in favor of private solutions. We should take more care of our precious public healthcare systems.
Not a non-American here, but an American who lives in another country, France. Yes, we know that healthcare is not free, but rather subsidized by high taxes, social security payments. And as I have had the good fortune to be in a high earning bracket, I pay those high taxes, social security payments. But nothing, and I mean nothing beats the feeling of knowing that when I need healthcare, whether it be for routine stuff or, as happened to me over the past 2 years, for life-threatening situations, blood clots, pulmonary edema, cancer, I do not have to worry about whether my insurance covers the cost of treatment, or whether some administrative foul-up means that treatment is delayed, or whether I am going to be prescribed some less expensive but older generation treatment in order to save costs. And even if I had not needed those life-saving treatments, I am not unhappy that I live in a country where high taxes and social security payments mean that the population in general is not required to worry about whether they will benefit from health care when it is most needed. I know that some people back home complain that this is socialism, but I think a line can be drawn between social welfare and socialism.
I was fit and well in my early 30s, no reason to suspect any of the below would happen. But I had infertility screening, followed by 3 goes of IVF, 1 fresh 2 frozen, including weekly well-being counseling. I was medicated for hyperemesis throughout my pregnancy. I developed hypertension, preeclampsia and had weekly then twice weekly hospital monitoring, and blood pressure medication. I was subsequently a hospital inpatient for a month before birth with preeclampsia, needing lots of meds and monitoring every 3 hours. I had an emergency cesarean section attended by OBs and neonatal. I was in a high-dependency unit for 2 days and a normal postnatal unit for a further 8 days. My son was born prematurely at 33W, spent 3 days in NICU and 23 days in SCBU. I had daily midwife BP checks after discharge, a follow-up hour-long debrief appointment with my consultant, organ scans to check for damage, and my son had several follow-up appointments with neonatal until he was about 2. I paid not one single penny for any of the above. Thank you NHS Scotland.
I got hit with a bottle over the head in a bar fight and the ambulance took me to hospital, put staples in my head, cleaned me up and I was back at the pub in under 2 hours. Didn't pay a cent. Only time I've ever needed it.
East Europe. It is officially free. Practically, 90% of medical services are done in private clinics and we pay for that. You go free if you can wait 3 to 4 years for a surgery or 6 months for a specialist consultation. If it's a simple cold it's okay, cheap and fast. You call a clinic, you're registered and have a visit within 2 to 4 days, sometimes the same day. Also, accident injuries are treated instantly. But, if you have a toothache, injured your knee and it simply hurts, forget it. They will tell you to take painkillers and you'll have a visit in few months. You will go blind lifetime unless you get eye surgery in 6 months? You'll have a date in 2 years. You have a cancer and require treatment? Well, if you're lucky you'll get one. If not, sorry, go die. Also, we pay monthly as a tax from our salary to support healthcare system, and if you're willing to pay for private services you can't simply sing off. In general, for most cases we pay for private care, but it's okay to have it in case of serious accidents.
Excellent, although the right-wing beep are constantly trying to dismantle it.
I was in the States until I was 25, now in the UK for over 15 years. Happy to answer comparative questions.
May your day be filled with joy and happiness. And please remember to like, share, and subscribe for more quality content every day.